Good evening, study partners. Welcome to Wednesday Night Study Live, where we complete 10 practice questions to help you pass your addiction counselor exam. Today's study live is going to be on alcohol use disorder. So, all of our questions are going to be based on the DSM 5 criteria for alcohol use disorder. Welcome, welcome, welcome. Come on in. Good evening. If you're new here, I'm Letitia, a licensed professional counselor and licensed substance abuse treatment practitioner. I provide substance use and mental health education and trainings, and I support future counselors just like you with studying and passing your addiction counselor exams. So again, welcome and hello to the playback. As you're coming in and watching the video, make sure you are subscribed first of all. Make sure you're subscribed, so hit the red subscribe button, but also hit the gold bell button. That's how you'll get reminders when I post new study videos, and when I post in the community posts. I try to keep you guys updated. So again, welcome and welcome back to those of you who are already in our study community. Good evening. Good evening. Hello, good evening. Good evening. Thank you for joining. Happy to see everyone. Again, hello to the playback. I know everyone can't make the live, but make sure you always watch the video so you can get your study time in. If you're catching the playback, just make sure you say hello in the comment. If you're a new study partner, put the state in the exam that you are studying for. And if you're not studying for an exam, let me know what course you're taking, what program you're in, why are you watching the video, is there specific topics you want to learn about. We're happy to have you here. All right, so we have a question. When do you know when you're ready to take your exam? That's an interesting question. Maybe you guys can help me, because it's kind of like a personal thing. Only you know yourself. But I would say when you're looking at your domains and when you're looking at your testing site. So for example, if you're taking the ADC, you should have already downloaded the information that they have on the ICNRC website. And there's about 4 or 5 domains. And for each domain, if you can answer questions without having to look things up, without having to, you just understand the concept. You have a good grasp of each domain. So for example, with assessments, if you're answering questions on assessment and you're getting them all right, you understand assessments in addiction counseling, you're probably ready. You've mastered the assessment portion. So once, in my opinion, once you feel like you have a good grasp on each study domain, the topic, you're probably ready. What do you think, guys? Put in the chat. How did you know if you've already passed your exam or some type of licensing exam? Maybe you're already a licensed counselor and you're studying for an addiction counselor certification. How did you know when you were ready? I knew I was ready when every single domain I could get the questions right. And if you watched my original video, you guys, you already know drug schedules and actual substance use drugs was my that was my weak area. So after I felt like I mastered all the other areas, I just doubled down on drugs, medications, because I really didn't know a lot about that area. Once I started getting 80% on practice exams, or I would test myself, I had flashcards. Once I knew that my weak area had improved in all 5 areas of the NCAC1, I felt confident. Then I felt like I was ready. So when did you guys feel like you were ready? Some of us are so hard on ourselves, we probably never feel ready. So, but that's another conversation. Oh, okay. So I'm working on taking my MAC in Colorado. I will add, so for those of us who are taking the advanced exams like the MAC or the AADC or the NCAC2, clinical reasoning. So you should be able to test on a topic in any format. Not saying the Mac is going to have different formats, but I feel like if you can answer a scenario question, if you can answer a question in writing form and multiple choice form, you're ready. That means you can think through it in a clinical way. So your clinical reasoning is solid, your foundational knowledge is solid, and you have a good grasp on the topics. Okay, Jamie Faith says, I'm taking NCE2 and taking your practice exams and miss like 5 out of 50. That's still good. That's really good. Tyler Paula 1785, do you provide individual study sessions? No, unfortunately, currently I don't provide individual study sessions or coaching. I just don't have the time to do that. I've put the study resources link in the chat though. So right now I just do the videos. The idea is for me to get a certain amount of videos to where this can just be a hub for anybody who's studying for addiction counseling exams. And you can just come to my YouTube page or you can get additional study resources at the link on my Stan store. That's really good, Sheila. 5 out of 50. All right. So now that I know you guys can hear me, well, let me confirm. Please put a 1 in the chat before I move forward. We're going to jump right in today. Again, make sure you like the video. Save the video, share the video with someone who you think it can be helpful for. This way it gets us in the algorithm. We're on our way to 2,500 study partners, everyone. I'm so excited for us. So we're finding our people all over the country. So if you are taking an addiction counselor exam, an addiction counselor class, if you're taking some type of certification, or if you're studying for the ADC, the AADC, the MAC exam, the NCAC1 or the NCAC2, this is your place. We master addiction counselor topics so that you can pass your exam. All right, welcome study partners. Hello to our new study partners. Hello to the playback. Today we're going to gather to do our 10 practice questions. It's going to help us with clinical reasoning. As I stated before, we're not practicing for a specific exam, but it's helpful for several different exams because we are learning the foundation and the clinical knowledge of certain topics. So if you're able to think through questions, you're most likely to be able to retain the information. I'll read the question, I'll read the answer choices, and you put your answer in the chat. And then I reveal the answer and I have explanations for the correct answer and the incorrect answer. So you can kind of double down. You get like extra study, you get a bang for your buck. Instead of just me revealing the correct answer, I'll explain the incorrect answer. So that'll help you out too. And then at the end, we do Q&A. So if you have a question about an addiction counselor exam, addiction topics, whatever time we have left at the end, you can ask the question and I promise I'll answer. If you're watching the playback, you can put questions in the comment area too. I answer every single question. I'm still keeping up. We'll see as we continue to grow if I need to get someone to help me out. But for now, I answer every single question. Okay. All right, I see your ones, so we'll go ahead and it's 10 questions. We'll go ahead and get started. It usually takes us about 40 minutes to an hour to get through. Alcohol use disorder is a problematic pattern of alcohol use that leads to significant impairment or distress. The DSM-5-TR uses 11 diagnostic criteria to determine whether a person meets the criteria for a substance use disorder. As addiction counselors, it's important to remember that diagnosis is not based on how much someone drinks. Instead, diagnosis is based on how alcohol affects the person's behavior, relationships, responsibilities, health, and overall functioning. The severity of alcohol use disorder is determined by the number of symptoms present within a 12-month period. A person who meets 2 to 3 criteria is diagnosed with a mild disorder. Meeting 4 to 5 criteria indicates a moderate disorder, and while 6 or more criteria indicates that they have a severe disorder. For the exam, remember these 3 concepts. There are 11 criteria. Diagnosis is based on impairment and stress, and severity is determined by the number of symptoms that are present or that the client reports. So that's just like a quick crash course in the DSM-5 criteria, specifically alcohol use disorder. I've put a link in the description for those of you who don't have a DSM-5. I've put 3 different links. One is the DSM-5 TR. It's a little pricey, but then I put another link of the old DSM-5 because that's very helpful too. And then for budget friendly, there's a 3rd link where it's like a quick laminated DSM-5. If you are preparing for licensure or certification, you plan on working and you'll be diagnosing, that is your friend. Because remember, we don't memorize all of everything. Don't pressure yourself to think you have to memorize every single substance use disorder, every single DSM-5 disorder, mental health disorder. No, as working clinicians, we good clinicians, we keep our books. We keep all the information we need, and you learn as you go, and you retain some stuff. And when you don't know, you request supervision. And you also look into your DSM-5. I got my DSM-5 right here. I keep it with me. And my ASAM criteria. Let me see. Let me turn back on my camera so you guys can see. See? This is my old DSM-5. I have the DSM-5 TR on PDF. Because, remember, we're not expecting perfection. For the exam, you're answering questions to show that you are capable. But as you continue to grow as a clinician, you just learn. You don't pressure yourself to remember things. All right. Let's get back to it. Exam focus. Now for a quick check-in. For alcohol use disorder, there are 11 diagnostic criteria. There's a 12-month time frame. You're focused on what functional impairment the client has, or like what's going wrong, what's getting in the way of them functioning daily. The severity equals the symptom count, and you're always going to include tolerance and withdrawal. Now, if they don't have tolerance, if don't have withdrawal symptoms, that does not mean that they don't meet criteria. Remember, there's a certain number of criteria that they can still meet. Question 1. Client A went on a drinking binge for 7 days following the unexpected loss of their spouse. Which of the following is the most clinically appropriate reason to avoid immediately diagnosing alcohol use disorder? A. The client's alcohol use appears to be connected to a recent life stressor rather than an established pattern of symptoms. B. The client's alcohol use has not yet resulted in enough social, occupational, or health-related consequences. C. A diagnosis requires evaluation of DSM-5 TR criteria over a 12-month period, not a single week of alcohol use. Or D. The client's alcohol use may be considered normal because grief commonly involves emotional distress and behavior changes. So which is the most clinically appropriate reason to avoid just immediately diagnosing the client with alcohol use disorder. So client went on a binge after the loss of a spouse. So we're assuming there's some grieving, some inappropriate coping. Why should we not just immediately say alcohol use disorder? Okay, let's see what you got in the chat, guys. Lots of C's. I see a sea of C's. Okay, let's see. The correct answer is C. A diagnosis requires evaluation of DSM-5 TR criteria over a 12-month period, not a single week of alcohol use. C is correct because this is reasonable clinical consideration. Oh, my apologies. C is correct because the DSM-5 TR requires assessment of the 11 criteria occurring within a 12-month period. A 7-day binge alone does not provide enough information to determine whether diagnostic criteria are met. A is incorrect because a person can develop or have alcohol use disorder even when alcohol use is triggered by stress or grief. Additional assessment is still needed. C is incorrect because the DSM-5 TR requires assessment of the 11 criteria occurring within a 12-month period. That's the correct answer. And D is incorrect because while grief may contribute to increased alcohol use, clinicians should not assume the behavior is normal or automatically rule out a substance use disorder. A thorough assessment is still required. Exam tip: a diagnosis of alcohol use disorder requires an assessment and use of DSM-5 criteria, symptom patterns, and impairment over a 12-month period. Remember, avoid diagnosing too soon or off one single episode. Question 2. Client B reports the following symptoms within the past 12 months: strong cravings for alcohol, repeated unsuccessful attempts to cut down, spending significant time drinking or recovering, drinking more than intended, developing tolerance, experiencing withdrawal symptoms. Client B also reports successfully running a $1 million company, maintaining family responsibilities, having no history of DUI arrests, and feeling optimistic about the future. Why would client B still be diagnosed with severe alcohol use disorder? A. Severe alcohol use disorder requires major problems in every area of functioning before a diagnosis can be made. B. The diagnosis is based on the number of DSM-5 TR criteria present, not whether a person appears successful. I gave away the answer. Sorry, guys. C. The diagnosis is primarily determined by the amount of alcohol consumed on a typical drinking day. Or D. A diagnosis of severe alcohol use disorder is based on the presence of tolerance and withdrawal alone. So he has a lot of symptoms, but he appears to be holding it together. He's running a successful $1 million business. He's maintaining family. Actually, he appears to be functioning well daily. He's just using. Why does he still meet criteria for alcohol use disorder? The correct answer is B. The diagnosis is based on the number of criteria present, not whether a person appears successful. I just want to say also with culturally competency, you would know depending on how people show up in their everyday life is really based on what they feel like the expectations are. So sometimes they may meet criteria and they may really be in danger and need immediate help, but it looks like they have it all together. So it might be a male that feels like they have to keep it together because they're the breadwinner. It may be a specific religion that they may be ashamed of stigma. It may be a woman or single mother who feels like, okay, it's just me, so I have to keep it together. So a lot of times you have to think about the full picture. And also, if you're meeting some of these clients in the office, people put on their best, they come even if they need help. So the biggest thing is to use your criteria, understand your criteria, keep your DSM-5 with you. B is correct because DSM-5 determines severity based on symptom count. 6 or more criteria indicate a severe disorder, regardless of income, regardless of employment, regardless of outward success. So he will meet criteria. A is incorrect because a person does not need to experience impairment in every area of life to meet a diagnostic criteria. C is incorrect because the DSM-5 focuses on symptoms and consequences, not simply the quantity of alcohol consumed. And D is incorrect because tolerance and withdrawal are only 2 of the 11 criteria. Severity is determined by the total number of criteria met. On the exam, don't confuse success with wellness. A person can maintain employment, be financially stable, and complete their family responsibilities while still meeting criteria for a severe substance use disorder. All right, question 3. Client C completed an ASAM assessment and reported increased tolerance to alcohol over the past 30 days. Based on this information alone, which severity of alcohol use disorder can be diagnosed? A. Mild alcohol use disorder because tolerance represents one diagnostic criterion. B. Moderate alcohol use disorder because tolerance indicates physiological dependence. C. Severe alcohol use disorder because tolerance suggests progression of the disorder. Or D. No severity can be determined because ASAM ratings do not establish a DSM-5 diagnosis. So based on the information we have, which severity of alcohol use can be diagnosed? Can we even diagnose? They completed the ASAM assessment. Okay, let's see what you guys got here. All right. What do you guys think? Client completed ASAM assessment. Reports increased tolerance. What severity level? Can we diagnose? Okay, I see D, Della D, Jessica D, Sheila D, Stephanie has a D, Zach, Sherry, Jamie. All right, let's see, guys. The correct answer is D. No severity can be determined because ASAM ratings do not establish a DSM-5 diagnosis. D is correct because ASAM and DSM-5-TR serve different purposes. The ASAM assessment determines treatment needs and level of care, while the DSM-5-TR determines whether a substance use disorder diagnosis is present and its severity. Additional assessment with the DSM-5 criteria is required before assigning a diagnosis or severity level. Exam tip. Don't confuse the ASAM with the DSM-5. ASAM equals level of care. DSM-5 equals diagnosis, and they work you use them together. I do DUI assessments. I use both. All right. Question 4. Client D reports drinking heavily every weekend. Over the past year, they have received multiple warnings at work for missed shifts, have frequent arguments with family members about their drinking, and recently received a DUI charge. Which concept is best illustrated by these examples? A. Alcohol use disorder is primarily defined by the amount of alcohol a person consumes. B. Alcohol use disorder is characterized by tolerance and withdrawal symptoms alone. C. Alcohol use disorder can result in impairment across important areas of daily functioning. Or D. Alcohol use disorder is diagnosed when alcohol use leads to legal consequences only. The correct answer is C. Alcohol use disorder can result in impairment across important areas of daily functioning. C is correct because alcohol use disorder is associated with functional impairment in areas such as work, school, relationships, health, driving, legal involvement. These consequences often help clinicians identify the impact of alcohol use on the person's life. A is incorrect because the diagnosis is not based solely on quantity consumed. The DSM-5 TR focuses on symptoms, impairment, and distress. So, someone could drink too much and black out. Yes, that's problematic. That is not good. However, you can't just use that alone and then meet criteria for alcohol use disorder. B is incorrect because tolerance and withdrawal are only 2 of the 11 diagnostic criteria and are not required for every diagnosis. And D is incorrect because legal problems may occur, but they are not required for a diagnosis and are not sufficient by themselves to establish alcohol use disorder. So remember, for the exam, if you're asked about diagnosing or if you have a scenario, you focus on how the alcohol use affects the person's functioning. Question 5. Which statement best distinguishes alcohol use disorder from alcohol intoxication, alcohol withdrawal, and alcohol-induced mental disorders? A. Alcohol use disorder reflects a persistent pattern of problematic alcohol use, where intoxication, withdrawal, and alcohol-induced disorders are clinical syndromes associated with alcohol use. B. Alcohol use disorder is diagnosed when intoxication, withdrawal, and alcohol-induced disorders occur together and produce significant impairment in functioning. C. Alcohol use disorder is identified by long-term alcohol use, whereas intoxication, withdrawal, and alcohol-induced disorders are identified by short-term alcohol use. Or D. Alcohol use disorder occurs when alcohol-related symptoms become chronic, whereas intoxication, withdrawal, and alcohol-induced disorders represent temporary stages of recovery. Which one best describes the difference between alcohol use disorder and alcohol intoxication, withdrawal, or alcohol-induced mental disorders? So they're asking you, what's the difference? What's the best answer that describes the difference? Let's see what you guys are saying. Okay, I see a B. I see an A. Couple B's. Yeah, and it's wordy too, Sheila. with strong distractors. But just guess your best. I'm going to give you the answer in a moment. Okay. The correct answer is A. Alcohol use disorder reflects a persistent pattern of problematic alcohol use, whereas intoxication, withdrawal, and alcohol induced disorders are clinical syndromes associated with alcohol use. So the key word here is pattern. So alcohol use equals pattern of behaviors that affect functioning. Alcohol use, alcohol intoxication, someone is just drunk, intoxicated, feeling the immediate effects of drinking. Withdrawal is when they stop and they feel the effects of not drinking. They're feeling the effects of long-term use dependence. And then obviously the alcohol induced disorders, they're coming with more, that includes mental health symptoms after drinking or after withdrawing. So come up with a catchy way to remember, because you may get a tricky question where they're asking you about how to diagnose or how to tell the differentials. And they may describe someone who has a mental health diagnosis but does not meet criteria for alcohol use disorder. Okay, now let me give you your explanations. A is correct because alcohol use disorder describes a pattern involving impaired control, social impairment, risky use, and other symptoms. The others are separate clinical conditions that may occur in the context of alcohol use. B is incorrect because a person can meet criteria for alcohol use disorder without experiencing all three conditions, and the presence of these conditions alone does not establish the diagnosis. C is incorrect because the distinction is not based on the duration of use. The key difference is that alcohol use disorder is a pattern of problematic use, while the others are specific alcohol-related syndromes. And D is incorrect. Oh, sorry, y'all. Guess I'm relaxed. D is incorrect because intoxication and withdrawal are not stages of recovery, and alcohol-induced disorders are separate diagnoses that can occur during active alcohol use. So again, is it a pattern or is it immediate response to using alcohol, which is considered a syndrome, not a disorder? All right, question 6. According to the DSM-5-TR, alcohol use disorder is defined as a problematic pattern of alcohol use leading to clinically significant impairment or distress, with at least 2 symptoms occurring within what time frame? A 6-month period, B, a 12-month period, C, 18-month period, or D, a 24-month period? Okay. So what is the time frame? You're doing an assessment. A client is reporting symptoms. You're assessing for alcohol use disorder. What time frame are we basing it on? The symptoms have to occur within what time frame? Okay, I see a D. I see some B's. Okay. The correct answer is a 12-month period. B is correct because the DSM-5 requires that at least 2 of the 11 diagnostic criteria occur within a 12-month period to support a diagnosis of alcohol use disorder. A is incorrect because the DSM-5 does not use a 6-month time frame when determining whether alcohol use disorder criteria are met. C is incorrect because although symptoms may persist longer than a year, DSM-5 diagnostic criteria are evaluated using a 12-month time frame. So they will meet criteria, but the baseline is 12 months. And D is incorrect because the DSM-5 does not require symptoms to occur over a 2-year period to establish a diagnosis. Okay, so remember, 2 symptoms within a year, 2 symptoms over a 12-month period. Question 7. Which of the following is considered an environmental risk factor for developing alcohol use disorder? A. Having a biological parent with alcohol use disorder. B. Having a low sensitivity to the effects of alcohol use. C. Growing up in a peer group where heavy drinking is common. Or D. Having a twin diagnosed with alcohol use disorder. Which is an environmental risk factor? Okay, Naya, see your B. Stephanie has a C. Della A. Sherry C. Sheila C. Jessica C. Okay. The correct answer is C. Growing up in a peer group where heavy drinking is common. C is correct because environmental risk factors include peer substance use, cultural attitudes towards drinking, how available the alcohol is, stress, poverty, learned expectations about alcohol. So think there, who's around? Family, friends, neighborhood, environment. A is incorrect because this is considered a genetic or family risk factor rather than an environmental factor. And remember, genetic risk factors mean the level of risk. It doesn't mean just because you have a family member or a parent who has an alcohol use disorder that you will get it. It means your risk increases. C is incorrect because environmental risk factors include peer substance use. B is incorrect because low response or low sensitivity to alcohol is considered a physiological risk associated with increased vulnerability. Not an environmental, physiological, your body. And D is incorrect because twin studies are often used to demonstrate genetic influences on alcohol use disorder. But it doesn't mean it's not an environmental risk factor. Okay. Question 8. Client E presents for a substance use assessment and reports alcohol use. Which of the following questions is most clinically appropriate for determining whether alcohol use disorder criteria may be present? A. How many alcoholic drinks do you typically consume during a normal week? B. Has your alcohol use ever caused problems in your work, relationships, health, or daily responsibilities? C. At what age did you first consume a full alcoholic beverage? Or D. Do you believe alcohol is the primary substance causing concern at this time? Which of the following questions is most clinically appropriate for determining alcohol use disorder? And a question like this will fall under probably assessment and diet and maybe diagnosis and also counseling skills. So learning how to, first of all, build rapport and develop questions that'll get you the most accurate answer so you can diagnose appropriately. I like, okay. Okay, I see lots of bees. The correct answer is B. Has alcohol use ever caused problems in your work, relationships, health, or daily responsibilities? B is correct because this question directly explores functional impairment. Remember, we're looking for patterns and impairment, which is a key feature of alcohol use disorder and helps determine whether alcohol use is causing clinically significant problems. A is incorrect because the quantity of alcohol use is important to assess, but diagnosis is based on symptoms and impairment rather than the consumption alone. C is incorrect because the age of first use is clinically relevant and may inform risk. Also, environmental factors and so on, cultural identity, but it does not directly assess current diagnostic criteria. And D is incorrect because identifying the primary substance is useful for treatment planning, but does not directly assess alcohol use disorder symptoms. So for the exam tip, during an assessment, don't focus on how much, focus on the effects of the alcohol and how it's impacting functioning, relationships, responsibilities, work, and then obviously how many criteria the client meets. Question 9. Client F reports meeting 2 DSM-5-TR criteria for alcohol use disorder over the past year. The client denies withdrawal symptoms, is medically stable, and is willing to participate in treatment. Which intervention is most appropriate? A. Medically managed detoxification due to the presence of an alcohol use disorder diagnosis. B. Residential treatment because all substance use disorders require intensive services. C. Psychoeducation and outpatient treatment because the client appears to have a mild disorder. Or D. Inpatient hospitalization because alcohol use disorder carries significant health risks. So client F meets 2 criteria, denies withdrawal symptoms, is medically stable, and ready to participate. Which intervention is most appropriate? A question like this may fall under diagnosing, counseling skills, treatment planning, and or level of care. Okay, I see C. I see a B. Okay. Okay, a couple more C's. C1B. Okay, let's see. The correct answer is C. Psychoeducation and outpatient treatment because the client appears to have a mild disorder. So it's not on the severe end. You may have to do a little bit more assessing or ongoing assessment, but we know it's not going to be A or B or D. Those are for severe symptoms. Okay, let me get you the explanation. C is correct because 2 DSM-5 criteria can indicate mild alcohol use disorder. In the absence of withdrawal symptoms or significant safety concerns, psychoeducation and therapy are often appropriate interventions. A is incorrect because detox is generally indicated when the client has significant withdrawal symptoms or medical risks that are associated with their drinking. In this question, the client denies withdrawal symptoms. B is incorrect because treatment should be matched to the individual's severity and clinical needs. Not all substance use disorders require residential care or rehab. And D is incorrect because although alcohol use can present health risks, inpatient treatment is not automatically required based solely on the diagnosis. Okay, exam tip. Remember your alcohol use disorder criteria, but also remember we're trying to match the appropriate level of care, whether our agency is giving the level of care or whether we have to refer. Question 10. Client G reports becoming intoxicated, tripping, falling, and breaking their leg while under the influence of alcohol. Which DSM-5 alcohol use disorder criterion is best illustrated by this example? A. Recurrent alcohol use resulting in failure to fulfill major obligations. B. Continued alcohol use despite physical or psychological problems caused by alcohol. C. Recurrent alcohol use in situations in which it is physically hazardous. Or D. Alcohol is often taken in larger amounts or over a longer period of time than intended. Which DSM-5 alcohol use disorder criterion is best illustrated in this example? Client reports getting intoxicated, drinking too much, and falling and breaking their leg. Okay, I see a C. I see a B. Another B. See a few B's. Okay. The correct answer is C. Recurrent alcohol use in situations in which it is physically hazardous. C is correct because becoming intoxicated and engaging in activities that increase the risk of injury is an example of hazardous use. The resulting broken leg demonstrates the potential danger associated with alcohol intoxication. A is incorrect because the scenario does not describe problems with work, school, or family responsibilities. B is incorrect because this criterion would apply if the client continued drinking despite knowing alcohol was causing or worsening a physical condition. Tricky. And D is incorrect because the scenario does not provide information about the amount consumed or loss of control over drinking. So the reason why C is correct because we only know that the client reports getting intoxicated and falling and breaking their leg. It's not B because we don't know if it happened before and they continued to drink. We don't have that information yet. So remember, we only go off the information we have currently. Now, let's say the client came back the following month to the ER or your agency, wherever you work, and they go, yeah, I'm still in my crutches, but I still made my way to the bar. When I walked across the street to go get a drink, I hopped across the street even though my leg is broke. Now B makes sense because they are continuing the use despite breaking their leg. All right. Alcohol use key takeaways. In order to diagnose, you have to understand or find a way to remember the 11 criteria. The client must meet 2 of those criteria over a 12-month period. The severity is based on the number of symptoms present. And finally, remember the diagnosis is not based on simply how much they drink or the fact that they even drink. Addiction counselors must assess whether the alcohol use is causing impairments in important life areas such as work, school, relationships, so daily functioning. And this kind of ties into assessments too. So whenever you get a chance, you can go over and watch the assessment video under the core function playlist. Because if you have a solid assessment, you have a way to ask questions, a way to build rapport to get accurate information, you're more likely to have an accurate diagnosis and you'll be clinically solid. All right, let me get my camera back up and start. We got a few minutes. Hi, Diane. Do you help prepare for the CCJP exam? No, not specifically the CCJP, but I do know what it is now. I do know for the CCJP, you guys correct me if I'm wrong, you have to pass the ADC in addition to another exam. But our study videos and our study lives help with the ADC because the ADC is the most passed test in our learning community. So we've had study partners pass the ADC, the ADC, the MAC exam, the NCAC1, and the NCAC2. But by far, we've had more people pass the ADC. So it can help, but our study videos are not specifically geared towards the CCJP. But it can be helpful. Okay, Della says, can you do pharmacology test questions? I'm working on pharmacology. It's such a broad topic. So I'm thinking about we could do a study live on pharmacology because we could just condense it into 10 questions. But maybe I'm thinking about doing a playlist, a pharmacology playlist for addiction counselor exam. Stephanie says, that one is hard because how do we know the client is a recurrent user? So for that question, we only went off what they told us. So the correct answer was C. Let me go back. So they asked which criteria Oh, I see what you're saying. How do we know in that? So B and C. So if we were specific, it would be none of these answers. Okay, I know what she's saying. How do we know if the client is recurrent? So I should have worded that differently. But from B or C, the most closest correct answer would be C. Because I would consider breaking a leg physically hazardous. I would say physical or psychological problem is a little bit less severe than hazardous. But yeah, so maybe either in the question I should have said the client reports recurrent alcohol use, or more specific in the correct answer. I see what you're asking. Hi, Ashanti. And you're welcome. Thank you so much for for supporting the channel. Oh, someone passed? Sorry, guys. I listen. I'm trying to get better at streaming, you guys. It is not as easy as it's the youngsters make it seem, or as the streaming professionals. All right. So congratulations, Ashanti. She says, Tisha, I passed my AADC Monday. Congratulations, congratulations. And thank you for supporting the channel and coming to our study lives. Thank you, everyone, for showing up. We all got to show up. We all got to show up. Again, everyone can pass. Yes, I'm one of those people. I feel everyone is capable of passing whatever exam you're studying for. Sometimes it just takes us showing up and reading these questions that you probably already know the answers to, but just reinforcing the information, having conversation, and being around people who have similar goals. So congratulations, Ashanti. I'm so proud of you. Thank you for updating us. Please make sure you put it under one of the videos so I can pin it, so we can motivate other study partners. Okay, I am nervous about taking my second ADC, but I am better prepared this time. Yes, and best wishes. You can pass. Remember, nerves are okay, not too many. Anxiousness is okay, that just means you care. But do your study questions, do your practice tests. You got it. So for the next couple weeks, we're going to do DSM-5 stuff. Everything is going to be based on DSM-5 criteria, diagnosis. I'm going to do a video on top 5 substance use disorders you need to know for your addiction counselor exams. And for the lives, we're going to focus on disorders. So stimulant use disorder, cocaine use disorder. We're going to do some stuff on nicotine. I had one nicotine question on my exam. I'm not saying you're going to get one, but I don't want to forget about nicotine. Because that may come up. All right, we have 2 minutes. I'm going to hang around, you guys. Again, thank you. Make sure you like the video. Make sure you're subscribed. I put the link to the Stand Store. Even if you just get the free study guide, download the study guide, that automatically adds you to my email list. And I can manually remind you of the lives. So if you subscribe to the channel, hit the button, you should get a reminder from YouTube. But if you don't, no worries. If you download the free study guide, I get your email and I manually send out an email to remind you of the study lives and when I post new study videos. Thank you. Thank you, everyone. Thank you for supporting the channel. Okay. And congratulations, Diane. Okay, I passed the ADC and now I'm registered as the CCJP. Congratulations, Diane. I'm sorry I didn't see yours. So Ashanti passed the AADC. Diane passed the ADC. Congratulations to you guys. Very proud of you. Thank you for updating us. Because we need that so other study partners can see. So Diane, if you're still here, when you do the CCJP, once you pass the ADC, do you get that certification or is there another like legal part? So if you're still here, Diane, and thank you, Diane, because I'm interested now. I had never heard of the CCJP certification until I started making the videos. So to my knowledge, it's like legal based, the legal part of substance use issues, and you have to pass the ADC. Do you have to pass? Is there like a legal part you have to pass? Okay, Jessica says, curious to know about the nicotine question. I can't remember the exact question. I passed the NCAC one in 2016, Jessica, but I remember when I saw the question, my heart dropped because I had never, I didn't study anything about nicotine. I was just so focused on the medications and benzos and opioid use disorder. I was just all over the place, y'all. That's what gave me this idea when I said I want to take my I want to start doing YouTube videos again, because I was overdoing it, y'all. Just running myself ragged towards the end. But I just remember, I remember two things about my test. I had two things that I remember that stood out to me. I had a AA question, but I was familiar with AA because I'm not sure if I shared my story. I've had family members. I've supported them in AA. I've had family members that struggle with substance use disorders. So I knew what AA was, and I knew it wasn't therapy. So that question, well, I was just surprised. But the nicotine question, I was like, so I'm sorry, I don't remember the specific question, but that's why I say I'm not going to leave out nicotine. Thank you, Juana Tiga 31. I appreciate you. Thank you for supporting the channel. So yeah, and also my first year as a certified substance abuse counselor, someone requested nicotine cessation services. And I was like, you know what? I think sometimes we forget about nicotine. I'm not sure, maybe, but I want to add just some foundational stuff so we don't forget, nicotine still isn't a substance addiction. All right, guys. Well, thank you guys so much. I appreciate you for supporting the channel. Congratulations again to Ashanti and to Diane. Best wishes to everyone who's taking their exam within the next week, within the next 2 weeks. I put the link in the chat. So if you need the free download, and then I have two additional resources if you want those. I have a link to 3 different price levels of DSM-5. Have the regular DSM-5, but no worries, that's a little pricey. I have the old one. There's a link. I think that's like $55. Start with the old one, and then whenever you get a chance, you can get the more expensive one. And the most affordable one is like a laminated, like a quick study. It's like $8. But either way, figure out how you can get your hands on DSM-5 information. That way you can start mastering the substance use disorder criteria. Okay. Good night, everyone. I'll see you next week. Thank you.